We as a company turn tragedy into hope. We support families in their time of need and guide them through one of the worst days in their lives, while giving others a second chance at life.
We work closely with our medical teams in our hospitals to offer the rare opportunity of organ, eye, and tissue donation to our families at end of life. We also work hand in hand with our Donate Life ambassadors to educate and inspire our community to say yes to donation.
Quirky, funny. Everyone is just their own individual personality, and no one is stifled here. People can just be who they are.
People at Donor Network West come to work every day knowing why they're showing up. They know what they do is going to make a difference.
I think Miracle Workers is probably pretty dramatic, but I think that is essentially what we do.
The challenge. The challenge to create something fresh and new, but I think more so the challenge to create something engaging that will inform people of how important organ donation is.
A couple years back, I had the privilege of being in the OR for a pediatric donor that I and several others had worked really, really hard on over a number of days. And I remember very quietly at the end of the case, the surgeon said, my patient would absolutely die without these organs. He was getting a liver, kidneys, and a pancreas, so big transplant. And I knew all of our efforts made all the difference for another family.
My motivation comes from my father, who's a double heart transplant recipient. And I want to honor those courageous families and those courageous patients that gave my father the additional time to see his children grow up and his grandchildren to grow up and soon to be great-grandchildren grow up.
Donation has affected my family. I have several family members and friends that are on the waiting list. Some have been blessed by another family that has said yes to donation, and others have passed away on the waiting list. I have always vowed to come to work and do my best to support the mission.
Considering I started as a clinical procurement coordinator and I was not a nurse at the time, and being the first non-nurse that was ever hired into the clinical role, you can see the progression as now I take on an executive leadership role, my growth through Donor Network West and my training as a clinician to my training as a supervisor and manager and director. It has helped me tremendously grow. The leaders that I've had here are my mentors, people I trust, and people who I really admire.
It's those moments on cases that feel impossible when you're exhausted and you're in tears and your colleagues or your hospital partners are frustrated and it feels like there's no way to see a good outcome. And somehow, collectively, we pull together and make the impossible possible and save lives. That makes me proud.
I'm most proud of my coworkers, the way we collaborate on projects and how everyone just is ready to jump at an opportunity.
I've had many proud moments. I've received many community awards. But in 2012, when my husband, my nephew, and my cousin gave the gift of life, that was the most proud moment in working in this organization.
We have an ambassador here in Nevada. Her name is Amy, and her attitude is always 100 miles an hour, always smiling, full of energy. Those who know me think I have a lot of energy. Amy has a lot of energy. She is a kidney panc recipient, and every day that she gets up, she says, I'm not getting up every day because I have to, but because I get to. It's an opportunity for her every day to do things different and embrace the day.
There was a young donor named Jared. His mother was at his bedside constantly, and over the course of the donation process, we got to know each other quite well. She told me that Jared was obsessed with superheroes and his favorite was Spider-Man. She wanted me and everyone on his hospital team to know that with great power comes great responsibility. We're all superheroes, just like Jared.